afternoon, viewers. Welcome to today's episode on drug abuse. My name is Adiola Jolaya, and today we're discussing on the causes and effects of drug abuse. Before I introduce our guest, we'll be going on a short break.
Hi everyone, I'm Oluwani Femi and I'm the founder of Nini's Essence. At Nini's Essence, we believe fragrance is a way to shine Christ's beauty. Own your glow with Nini's Essence, available at OST Ikere Ekiti. And our contact details will be displayed on the screen with our social media handles. Feel free to DM, order yours now. We'll be expecting you. Nini's Essence, unveil the essence of you. Bye!
Welcome back, viewers. Our guest, can you introduce yourself to our viewers?
My name is Nosoyekomi Fetulani Femi.
Welcome, Nosoyekomi. Thanks for honoring our invite.
You're welcome.
Ma, what is drug abuse?
Drug abuse is also known as substance abuse.
Okay.
And it refers to the act of misusing drug which affects the mind, the cognitive, and which causes harm, impairment, and dependence or addiction to the body system.
Okay, thanks for your response, ma.
You're welcome.
What are the most prevalent health consequences of drug abuse?
Prevalent health consequences of drug abuse are in several factors.
Okay.
So I will just mention like 3 factors here. Okay. We have the physical factor, we have the mental factor, and we have the individual factor, like family background, as a result of family background. Okay. So the physical factor can be as a result of damage to the organ system. Like one of the effects is it causes damage to the organ system.
Okay.
That such as cardiovascular disease. Cardiovascular disease is related to the heart. So abusing of drugs or misuse of drug, it affects how blood flows, the circulation of blood into the heart and all that, leading to cardiovascular disease. Okay. Then we also have liver disease. Those are one of the physical factors. Liver disease such as hepatitis B, liver cirrhosis. So those are the diseases that can be found as a result of damage into the liver, as a result of when there is misuse of drug or misuse of substance abuse to the which causes damage to the liver. So I've made mention of liver cirrhosis and hepatitis A and B. Then also we have depressed immune system. It depresses the immune system in a situation whereby when a drug is being abused, when there is when individual abuses a drug, so there is high risk of infection to set into such an individual, because misuse of drug abuse, I said it the other time that it depresses the immune system. So definitely if you abuse drug, maybe you did not take the drug in a normal way. We know different type of drug abuse such as heroin, cocaine, Indian or misusing even this paracetamol. So it can causes damages into your body, thereby reducing your immunity, your immune system in the body. Okay. So those are also the physical factor. Then also we have the mental factor, such as cognitive impairment, depression, anxiety. So the misuse of drug, it leads to depression, it leads to anxiety. So the reason why I said this is because for us to understand the fact that taking drugs, most people are already dependent on that drug. They are already addicted to the drug. So thereby leading to mental impairment. Most of the people you see that has all this mental illness, most of the source can be as a result of drug abuse, because you've already abused drug. So the range at which they abuse that drug has really affects their mental health. So most of them in the hospital, you see them as a schizophrenic patient, you see most of them as a manic patient, you see most of them having bipolar in the clinic. So those are the mental problem or disorders that we featured as from drug abuse.
Okay.
So it affects our mental health, even neurosis such as anxiety. It's also one of the example of cognitive impairments which affects in which this drug abuse affects the mind and the cognitive, that is the the mind and the brain of such an individual, the intellect of an individual. Then also the next point here is psychosis. Drug abuse causes psychosis in an individual. I've said it the other time, such as bipolar and all that. Then it reduces our immune system. Then also it increases the risk of suicide. By the time you are able to withdraw somebody that is already addicted to drug, you wanted to withdraw that person, it will be very difficult, because if you are not a ex practitioner or without the help of God, you will not be able to withdraw such an individual from drug abuse. So you such a person might tend to have the risk to commit suicide. So it's also an effect or consequences of drug abuse health problem. Thank you.
Thanks for your wonderful response, ma. We'll be going on a short break.
Hi everyone, I'm Oluwani Femi and I'm the founder of Nini's Essence. At Nini's Essence, we believe fragrance is a way to shine Christ's beauty. Own your glow with Nini's Essence, available at OHT Ikere Ekiti. And our contact details will be displayed on the screen with our social media handles. Feel free to DM, order yours now. We'll be expecting you. Nini's Essence, unveil the essence of you. Bye.
Welcome back, viewer. For those joining us for the first time, today we are discussing on the causes and effects of drug abuse. Ma, our next question to you: What do you think can be done to curb the spate of drug abuse?
Okay, thank you.
Welcome.
One of the things we can use to curb the spate of drug abuse is, the first thing is education and awareness.
Okay.
So you have to educate your patients or individual or your clients, that you have to educate them on the risk, the effects and the consequences of drug abuse.
Okay.
Like they should be aware of the effects of the risk, and also they should be aware of their environment. So that's the first point there. Then the second point is support system. They should have a strong bond relationship with their family, their friends, and maybe their pastors, their counselors. So as a normal individual, you have to have a good relationship, because people without good relationship, most of them tends to have depression. You understand?
Yes.
And most of them tends to be anxious. Even they will be like, there are some patients that they have delusion in the sense that example of delusion is trust delusion, paranoid. When you are being a paranoid patient, when you are being paranoid to something or to somebody, that is, you have no trust with somebody, to your friend. So a situation whereby you don't have a good relationship with your friend, with your families, you will not even have trust to lay your mind to them, to explain your mind to them. So those are one of the means of you curbing the space of drug abuse. So the second point I mentioned is support system. Try to make sure that your family supports you, that you have counselors that support you, you have friends that support you. I mean good friend, not the bad friends. Thank you. So the next point is access to treatment. Make sure that your hospital, your clinic, or your there is a therapeutic area for you. You understand, where it is easily accessible for you as an individual, for you to make complaint about your health, about yourself, about anything that you are passing through. Then also for you to know about the effects of self medication. So most people, they indulge themselves in self medication, which is absolutely wrong. So For instance, now in my clinic, most of the students, because I work in the clinic, so most of the students, they will come and complain that they have abdominal pain. You people call it stomach pain. So they complain that they have abdominal pain. And me, the students, they call it stomach pain. So meanwhile, stomach pain it can be in a different part in the abdomen. You call it stomach pain, we call it abdominal pain in medical line. But the thing is, there is a space where the stomach is located in the abdomen. You understand, in the abdominal region. So most of the students, because they have no knowledge about drugs, about taking of drugs, and they just misuse drug anyhow. Most of them take Fervin because they have stomach pain or they have menstrual pain. And fine, Fervin is actually good for menstrual pain, but are you a peptic ulcer patient? So most of the students, they have ulcer and they are taking Fervin for stomach pain. You know that is very wrong. So it's better for you to make a clinic be more accessible to you, like to find a clinic that is accessible to, that you can easily access, so that you can lay your complaint to them and explain to them the problem you are passing through, so that they can able to solve it for you. And the last point here is community engagement, like involving yourself in other things in the home, like sports, even in your school, involving yourself in recreational activity that can erase you from any other things that can improve your body system, boost up your immunity, that can take away your intellect away from anything bad. Like, I'm just trying to talk about diversional therapy. So diversional therapy in the situation whereby you derail yourself from anything that can injure your mind, your cognitive, your body system. So like sports now, exercise, when you imbibe yourself in all those activities, it will even cause more good than harm. There is no harm exercise can really cause you, because it will help the body to pump blood to several organs that you need blood to be pumped into. And for every other exercise like swimming, all those things, those activity, those recreational activity, it can actually help your body, your mind, and your cognitive, aside you misusing drug. So those are the community engagements. And try to engage yourself in any educational tips or any educational awareness around you. Maybe there is a program coming up around you, try to attend to any health education in your environment, so as for you to know the effects, the risk attached to drug abuse. Thank you.
Thanks for your wonderful response, ma.
You're welcome.
What can you give the youth and the people, what advice can you give the youth and the people who abuse drug?
Okay, one of the advice I can give the youth and to the people who abuse drug is they should stay informed. Like, from everything I've been saying since morning, I've actually made mention of health education, being health awareness, being aware about your health, stop being ignorant about your health. You understand? So the first point here is stay informed. Like, be aware about your health. Have a learned hearings. You understand?
Yes.
Like, you should be aware about your environment, about your health status.
Okay.
You should know the risk attached to your health status. Just take anything on your own or make judgments on your own. Then the second point here is resist peer group. Make a stand determination, make a strong affirmation within yourself that I am saying no to drug abuse, and try to follow people with positive mindsets, people with positive influence, and don't follow people with bad mindsets. The adage said, bad companies corrupt good manners. So show me your friend, I will tell you whom you are. So it depends on the type of friend you follow, the type of friend you accompany with, you mingle with. So it will definitely determine your own life. It will definitely speak of you. So you just have to resist the peer group and have your own stand, your own determination about drug abuse and about your health. Then the third point here is build a strong relationship. I've said it that time.
Yes.
Like build a strong relationship with your family so that you not have the spirit of mistrust within yourself. So that you not think that most of your parents, your family they hate you. Everybody likes you. So try to open up to your elderly people, to people that you know this person has experience more than me, or this person is literate within this area, especially your ex practitioners, and be accessible to clinic. Like try to access clinic or hospitals for your health. Don't just take judgments about your health or yourself. Avoid self-medication. So those are the advice I can give the youth. And always seek help when needed. Whenever you needed help, please seek for help. It is very important and necessary. Thank you.
Thanks for your contribution, ma.
You're welcome.
We really appreciate you for coming on today's program. I hope you'll come next time if we invite you.
Yes, no problem.
Thank you, ma.
You're welcome.
So our viewers, thanks for joining on today's episode. I hope you join us next time, next week, same channel. Thank you. Bye.